We have a few questions that bother us and want your reflections on them.
Oh, okay, thank you. I'm glad you found the workshops beneficial. Okay, what are your questions?
So our first question is, must every mental illness be labelled and the stigma attached to mental illness?
That's a great concern for all of us in the profession, and I think for the general public as well. Labels, I think somebody once told me, labels are for clothes, they're not for human beings. There's so much fear around mental illness, and I think because people do not understand the emotions and the challenges and the darkness of the emotions. So there's this fear around it that creates the labeling and the stigma. You know, when somebody is not well, when somebody has got a headache, you do not treat them unkindly. When someone is suffering from cancer, you do not treat them unkindly. It's the same as mental illness. When somebody is suffering because of the emotions in conflict within, you do not treat them unkindly. To label and create stigma is actually unkindness. So, you know, I'm sad when I hear people creating stigma around mental health and mental illness, or by calling them names or looking down on them. You know, for me, it's unkindness. And someone who works in the profession, we all go through different kind of sufferings all the time, don't we? That's all. That's all it is. That's all. And I think when we begin to treat one another with kindness and compassion, the mental illness, that stigma and label will be removed. But first of all, we in the profession have to remove it. Like you are telling me it concerns you guys, so you're anxious, how would you work with somebody with severe mental illness and all that. But the profession itself needs to change as well. You know, I like this, there's a charity, they call them Time to Change. You know, the first time I had Time to Change, I went, wow, it is time to change. The time to change is not to do with the public, it's to do with the profession as well. We created the labels. We created, somehow we are responsible as well. So when we change our attitude towards people that we are helping, then the public also will be able to stop that stigma and labeling as well and treat it. So we need to do that ourselves as well.